Part 1, Lily's parents meeting with the doctor.
Hi, I'm Dr. Martin.
I'm Clark Wilson, I'm Lily's dad.
I'm Linda Wilson, I'm Lily's mom.
Nice to meet you.
Nice to meet you.
Okay, so we are here to talk about your daughter Lily and discuss treatment options. So you know that golden heart syndrome is a fairly rare disease. It's a congenital craniofacial disease which causes abnormalities to the head and face. Now, treatment for golden heart syndrome varies depending on your symptoms. If a child has hearing loss, which Lily does, they might want to work with a speech pathologist or audiologist. That's to be expected. Lily will need speech therapy and oral rehabilitation if you choose to get her the auditory brainstem implant. So you know that. If there are problems with vision, the child may get glasses or undergo corrective surgery. In Lily's case specifically, she needs corneal transplant surgery. The good part is that usually children with golden heart syndrome have a very good prognosis. Once their abnormalities are treated, they're expected to live a fully normal lifespan and have a normal level of intelligence.
We have done extensive research on the subject, and we think we know what path we want to take for Lily. However, before we confirm our decision, Doctor, we'd like to discuss again our options. Like I said, we've talked about it a lot, and we think we know what's best to do, but we just want to be reassured that we're making the right decision for Lily.
Well, as you know, Lily's condition presents you both with several important decisions to make. You already know that she needs corneal transplant surgery. If the surgery is successful, this will immediately open the door to a lot more communication for her. Even though she still can't hear, you'll be able to start signing with her a lot more, communicating with her manually until further notice, and that'll get her started with language. As far as her hearing is concerned, she's not a candidate for cochlear implantation, but she is a possible candidate for the auditory brainstem implant. This is the best possible choice you have if you want her to be able to communicate via speech and hearing.
And how long is the recovery for the corneal transplant surgery? And how soon can we begin signing with her post-surgery?
The cornea tends to heal slowly. You'll need to protect her eyes in the days after the surgery. Your surgeon might ask you to have her wear a protective shield over it. Her vision may improve slowly after the surgery. It'll be important to avoid any possible trauma to her eye, such as from sports or rough play, that could damage her new corneas. I'd say you can start signing with her as soon as the surgeon or optometrist removes the stitches from her eyes, but the timing of that is entirely dependent on her healing and recovery process, as well as the decisions made by her surgeon.
Okay.
But if she gets the auditory brainstem implant surgery, she will be able to hear and start learning speech, right?
That would be the ultimate goal, but keep in mind that there is a lot that would have to be done in order for that to be accomplished. Assuming that the ABI surgery is successful, Lily would still need to undergo copious amounts of speech therapy, as well as oral rehabilitation therapy, since she's prelingually deaf.
Well, we are sure that we want to move forward in pursuing an ABI for Lily because we know that we want her to be able to communicate orally. We've discussed the pros and cons, and we know that it will require a lot of therapy. We just want her to be able to have the most opportunity possible to learn and communicate, and we both strongly feel that following through with an ABI is the best choice.
Mm-hmm.
Right, I understand, and I do think that the ABI has potential to provide a world of possibility. You just have to remember the possible risks associated with the surgery and the possibility that it may not be successful. I'm sure you know that in order for Lily to receive an auditory brainstem implant, she would have to be part of an experimental group. The experimental group will be the first to test these auditory brainstem implants on children less than 12 years of age. Auditory brainstem implants are very controversial right now, partially due to the newness of the implants and in part due to the rarity of the need for this type of implant. The structure of an auditory brainstem implant is very similar to a cochlear implant, with the only difference being that the electrode array is inserted into the first auditory relay station in the brainstem rather than into the cochlea.
Right, which is why we are willing to do anything in our power to have the most skilled and talented surgeon possible to perform the surgery. We want our daughter in good hands.
I completely understand, and I will do anything in my power to help make sure that that is the case.
So I guess my next question would be, assuming that the auditory brainstem implant is successful and Lily is on track to begin therapy, how extensive would her therapy be?
Well, you would be set up with a team of a speech pathologist and an audiologist, and they would spend time assessing her, and they would have a better chance of estimating how extensive therapy would be. Recipients of an ABI have more success when they use lip reading and visual cues. Research has shown those children who receive auditory brainstem implants as children, younger, are making progress in speech and hearing that compares to that of similar age children who have received cochlear implants. However, there are still large differences in performances among people who have received auditory brainstem implants. It really just depends on the success of the surgery and how well the implant takes. Even if Lily is making progress in her speech therapy and oral rehab, I would still suggest signing with her. While ASL may not be her primary mode of communication in the long run, it will at the very least serve as visual support to her speech.
Okay.
Thank you, doctor.
Thank you, doctor.
Okay. Part 2, meeting with the speech pathologist.
Hi.
Hi,
I'm Cheryl.
I'm Linda. Nice to meet you.
Nice to meet you.
I'm Clark. Nice to meet you.
Nice to meet you. So I understand that your daughter Lily is going to be receiving an auditory brainstem implant.
Yes, that's why we are here. We wanted to talk to you about the therapy that she's going to need post-surgery with speech. What can we expect? Our physician told us to talk with you about it and said you'd be able to give us a better idea of what would be happening.
Okay, well, I'm sure as you've been told, it will be a month post-surgery before the implant can be activated. Assuming the surgery is successful and the implant works, she will definitely need to go to speech therapy and oral rehabilitation very often in order for her to learn and listen and use speech. If the ABI gives her adequate access to sound, she should be successful using speech and listening in her own time. If her auditory brainstem implant does not give her enough access to sound, she may be recommended to enroll in an auditory training program where she would be taught to how to speech read, lip read, and optimize the sounds she does have access to. This is not an uncommon path to take. According to the House Research Institute, recipients of an auditory brainstem implant have more success when they use lip reading and visual cues.
So is there anything else that you would recommend? Like, what would you do if this were your child? What can we be doing in the meantime leading up to these surgeries that we know that she needs to have?
Good questions. I would definitely recommend that as soon as possible you get Lily involved in an early intervention program and an oral rehabilitation plan. Since Lily has a language delay due to her brain's atrophy and due to her hearing loss, the earlier she can be exposed to language in any capacity, the better. And I do think that until her vision fails her, ASL, American Sign Language, is an option worth looking into if y'all are comfortable with that. Some form of manual language is Lily's only option for the time being until she gets the auditory brainstem implant. And as a team of service providers, all we really do is try and present you with all the information you need in the most unbiased way possible.
Thank you. We hope to see you soon.
Thank you.